Hi, I am Dr.Bijayaraj. I am a consultant in family medicine in Aster MIMS Hospital, Calicut, Kerala. As a family medicine specialist, one of my main responsibilities is to keep my families healthy. As a part of that, I do a lot of periodic health examinations. And one of the frequent complaints which I encounter is diabetes. Most of the time, there are parents who are worried about their children. And I get this question very frequently, that doctor, will my child have diabetes? Is it possible to detect diabetes earlier than what it was detected for us? The answer is usually yes. We may not be able to detect diabetes early in all the cases, but we can make out a lot of risk factors which make these children prone to diabetes very early on in life. So we did a lot of research. We noticed that there are so many children who are overweight or even obese at a very young age. A simple way of making out obesity is to go and ask the doctor whether the child is weighing more than he or she should at that particular age. And the doctor should be able to easily tell you that. That is one of the first risk factors for diabetes. Secondly, lack of physical exercise. Thirdly, most importantly, if one of the parents has diabetes, there is about 25 to 30% chance that the child will have diabetes. If both parents are diabetic, almost half the children will have diabetes. Fortunately, these risk factors can be reduced. In addition, if the lifestyle of the child is not healthy, that means if the child is not actively physically playing enough, if the child is having too much of junk food, if the child is having a stressful kind of an existence, the risk for diabetes will be higher than what the child should be having. Then, something which we have to notice is our forefathers had a very different lifestyle compared to ours. They were hunter-gatherers, then they were farmers, and they were active workers, either working in some factories or on the farms. And we have a lifestyle where we are mostly sedentary, sitting in cabins. To top that, there's a bit of stress in the lives also. The children are also falling in the same line of lifestyle, and something has to be done to take them out of it. Make our children active, make our children appreciate the value of good health and a good lifestyle. Very frequently we find overweight children or obese children who have black colored skin over their necks or the armpits or in the thighs. This usually indicates something called as acanthosis nigricans. This is further an indicator of probably insulin being in excess in the body, which is a marker for diabetes in the future. For many years the insulin production is high, and then due to some reasons the insulin production starts deteriorating, starts coming down, and then the sugar levels rise, and then we are able to diagnose it as diabetes. So as I said, all these are risk factors or markers for diabetes even before the sugars have started rising, and these markers are visible starting from a very young age and usually visible at least by early adolescence. That is well within time to take corrective or preventive measures for diabetes. Another thing that has to be borne in mind is our attitude towards health and disease. It has to be kept in mind that you are not on one side and the doctor and the disease are not on the other side. The doctor or the healthcare support staff are always on your side, the patient's side, and the disease is the common enemy. And with that kind of mindset, we have to approach health or disease. If a doctor tells you that your sugars are too high and lifestyle may not be sufficient anymore to keep the sugars in control, and that medicines are needed from now on, please trust that decision. Because when the doctor advises medicines, most of the times they give good thought into what are the risks of that medicine, whether the benefits of the medicine are likely to outweigh the risks of that medicine, or whether the risk of the disease is far greater compared to the risk or the side effect of that medicine. Only when the risk of the medicine is low and the risk of the disease is high will a doctor usually put the pen to the prescription and prescribe a medicine for you. But once the decision is taken, please stick to that decision, because that will go a long way in keeping you disease free, and also to make the doctor, all the healthcare staff identify or understand your body better, so that further treatment can be betterized. So attitude, or the way we look at disease and healthcare, goes a long way keeping a person healthy in the long run. So these are the few points I just wanted to share, some points which don't really come into our notice in day-to-day life. And in case you have any comments or constructive suggestions, please comment below this video, and whenever time permits, I'll try to the best of my ability to respond to those suggestions or queries. Take care, have a good healthy life, all the best, wish you a good life. Thank you.